Over the past 18 months, there has been a huge burden on the NHS and social care services, with thousands of frontline workers being affected by the pain and suffering that they are seeing on a daily basis. With more and more people dying in care homes and at home, how has this crisis affected those working on the front line? To answer this and more, I'm joined by Dr. Nighat Arif. Dr. Nighat, thank you for joining us today. How has it been for you working as a frontline worker as a medic?
I think it's one of the toughest experiences of my career. I've been a doctor for 14 years, and the loss of life that I've seen, I would say in the last 18 months, has been on some degrees horrific, sometimes unexpected, and also to a degree, I would say that a lot of the time it was because we just weren't prepared. And that, in a way, as a doctor, is heartbreaking, because the whole point of medicine is that we try and have preventative measures in place to try and prevent illness. And to know that someone died from a virus because they had underlying health conditions, and the measures that we could have taken place if they were done earlier, if vaccines were taken up by certain groups of people, if we'd had made sure that actually that we were safeguarding the most vulnerable in our community at the right times, then it's a preventable death. And that is really hard. And on top of that, I've lost colleagues at the front line. So doctors, nurses, other healthcare professionals have died because they've got COVID-19. We've had issues with PPE right at the start for healthcare professionals, and also then access to facilities, because in our local area where I was practicing, there was a point where we were nearly running out of oxygen right at the height of the pandemic. And I think that taking all of that into account, the bereavement that we've suffered, we're still dealing with the trauma of it as a body in the health sector.
And how are you? And how have you coped? And how do you feel you have had the support networks in place that you and your fellow GP have needed?
Thank you for asking how I am, because I don't think many people have asked GPs how they are. Really, in the last sort of month or so, I've had a lot of anger towards healthcare professionals, mainly because of patients becoming frustrated by repeated lockdowns and access to GPs. So there's a lot of GP bashing that's happening. So morale is very low in the healthcare sector, because we do feel now that we're used as a political pawn. And on the other side, the backlog and the pressure in the NHS is so much that we have a lot of patients who've been sitting on possible symptoms that they just thought, I don't want to bother the GP with. And grief is one of them. Grief has psychological and physical outcomes. And so patients shouldn't be grieving alone, but they have been, because of having difficulty of having access to me and my colleagues.
And what is your experience with working with different cultural backgrounds and their experiences of bereavement?
I think in the last 18 months, the way that funerals happen have changed quite a bit. So I'm a Muslim, and in our faith, we have to do the funeral within 24 hours. And when we had a lot of people dying, that wasn't always easy. That meant that people from my community felt that they weren't able to do the last rites that they wanted to do. And that's the case for, my friends who are Hindus, and they've lost loved ones as well. So faith and culture played a huge part in how we've been able to do funerals, and then secondly, grieve as well. As a Muslim, we have 40 days of grieving afterwards, and then we do prayers for the person that's passed away. And the idea is that's your grieving moment, and then you stop grieving. But we know that that's not actually true, because you don't ever stop grieving. That person will remain with you for the rest of your days. But also in a juxtaposition, a weird way, I've had some really funny stories about the person that's passed away, because to keep their memory alive, having happy, funny stories, talking about the things that they got up to, their legacy that they might have left behind, has really touched me. And I think that is across all cultures and faith groups as well. But it's really important to highlight to lots of communities who do become very internalized. My Pakistani community tend to internalize their grief. And so going to a grief cafe or having a coffee morning, talking about your loved one and remembering them, is something that is a bit unusual. But it's become sort of the norm. People have realized that they can do this. And I think it's because when you're doing it through Zoom, you start off in your own environment, like I am in my kitchen with your cup of tea. You get to have a chat about the member of the family that you've lost, and it feels comfortable. And then you can go out and then meet that person in real life. And that transition has really helped a lot of my patients, and also personally, because we've been affected by loss as well in the last 18 months. And so there are stories of real hope, and knowing that help is out there as well is really being the driver for a lot of these conversations almost becoming norm. And I think we need to understand that talking about someone passing away in death, it's actually not all doom and gloom. Sometimes you can have amazing stories and funny stories that get you giggling all morning, and you think, oh yeah, they did that.
As part of the UK Commission on Bereavement, we are asking healthcare professionals to come forward to share their stories and their reflections. To do that, simply search the UK Commission on Bereavement and you'll find lots of ways to share your story on our website.